Health and Safety Management System is the program document that should be followed by an organization to control risks through the management process. It defines the concepts and components of a health and safety management system. The lecture outlines recent developments in health and safety management, including the development of OSAS 18001 and accreditation. Two possible descriptions of H&S management system are flashed on the screen. According to these, the health and safety management includes the organizational structure, planning activities, responsibilities, practices, procedures, process, and resources for developing and achieving, reviewing, and maintaining the organization's OH&S policy. It is implemented through adoption of safety programs, which is described comprehensively in the preceding part of this video. Adopting traditional approach produces successful results in the use of safety programs. The performance of a program is measured using reactive indicators such as the number of accidents, injuries, and etc. A typical H&S management system has 5 key functions that are monitored through audits. These include devising a safety policy for the organization, planning and implementation, followed by evaluation through key performance indicators. Performance review of efforts and results obtained while implementing the management system form the 5th facet of the program in any organization. Effective health and safety policies set a clear direction of the organization to follow. The organization should establish and maintain arrangements to ensure the activities are carried out safely. These arrangements should be based on the results of risk assessment and any health and safety objectives that have been defined. The organization should also plan and prepare for a foreseeable accident, incident, and emergency situations. This ensures that an effective management structure and arrangements are in place for delivering the policy. There is a planned and systematic approach to implementing the health and safety policy through an effective health and safety management system. At all levels within the organization, people need to be aware of their roles and responsibilities. Individual OH&S responsibilities should be clearly defined. All personnel should be given the authority and resources necessary to carry out their responsibilities. The organization should document and maintain up-to-date sufficient documentation on its OH&S management system. The organization should establish and maintain arrangements to ensure that activities are carried out safely. These arrangements should be based on the results of risk assessment and any health and safety objectives that have been defined. The organization should also plan and prepare for all foreseeable accident, incident, and emergency situations. Performance is measured against agreed standards to reveal when and where improvement is needed. Active measuring systems used to check compliance with the organization's OH&S activities. Examples of active monitoring data include the extent to which plans and objectives have been set and achieved, whether a director for OH&S has been appointed, whether a safety policy has been published, the numbers trained in OH&S, the number of risk assessments completed, extent of compliance with risk controls. The organization learns from all relevant experience and applies the lessons. Review of performance includes determining whether OH&S plans have been implemented and objectives achieved, checking whether risk control measures are in place and are effective, learn from system failures such as areas of non-compliance, accidents, and incidents, promote the implementation of plans and risk controls by providing feedback to all parties, providing information that can be used to review and if necessary to improve aspects of an OH&S management system. Audits provide a comprehensive and formal assessment of the organization's compliance with OH&S procedure and practices. The end result of an audit should include a detailed written assessment of OH&S procedures, the levels of compliance with procedures and practices, and should, where necessary, identify corrective actions. One or more persons may undertake audits. A team approach may widen the involvement and improve cooperation. They should be independent of the part of the organization or the activity that is to be audited. At the end of the audit and before submitting their report, the auditor or the audit team should hold a meeting with the responsible manager of the audited area. The main purpose of such a meeting is to communicate the results of the audit to the responsible manager in order to ensure that it is understood and agreement is reached. Organizations should have procedures for both the reporting and investigating of accidents and incidents. The prime purpose of these procedures should be to prevent further occurrence of situation by identifying and dealing with the root causes. Provision of identified training needs is mandatory for smooth and efficient implementation of health and safety management system in any organization. Assessment of individuals to ensure that they have acquired and maintained the knowledge and skills necessary for the level of competence required is compulsory. This requirement is analogous to Regulation 7 of the Quarries Regulation 1999, which required the production of a health and safety document. This completes the basic requirements and concept behind adopting, designing and implementing health and safety management system in an organization. Proper implementation of H&S management protocols by companies ensures avoidance of accidents, prevents financial losses and ensure company success besides maintaining a good reputation. Important web links are flashed on the screen. Stay tuned for future courses by Technology, Education and Mentoring Center. Thank you very much for your time.